All right, everyone, we are here with Ozzy. Ozzy is one of our stem cell patients. He comes regularly. He has an incredible story, and we would like to share it with you guys. So, hi, Ozzy.
Hi there.
So, if you can tell us what made you seek out stem cells?
Well, I got sick with lung fungus. I was in a coma for 3 months. When I came out of the coma, I was in follow-up therapy for another couple of months. Finally got the ventilator off of me, and I was starting to breathe a little better after this lung fungus attack. And then fast forward, I went to I couldn't take care of myself. I couldn't feed myself. I couldn't cook food. So I went to a retirement community that was assisted living, and I was there for 11 months. And I met this woman there who had had stem cell therapy on her hip, and she had replaced her hip with that rather than the surgery. So I'm going, wow, that stuff actually works. So, but I started reading about it, and there's a lot of controversy. So I studied it for quite some time, and came to the other stem cell clinics and got interviewed to the doctors. And eventually, though, I found this clinic, Genesis, and I liked the altruistic view of my doctor and the people here. And so that's what brought me here. And then having that kind of knowledge about stem cells and molecular biology and how it works, and that the stem cells travel to the part of your body that needs the help, needs the healing. The lungs, for me, were very irritated and inflamed, and I couldn't really walk across the street. Now I can walk almost 3 miles up hills and down hills with my dog, and it's a wonderful experience. It's been 115 days since I had my first IV, and my taste buds came back the next day. My allergies went away the next day. I haven't taken any antihistamines. It resets your immune system. I feel healing all over my body. I've had follow-up treatments for my right hand. I'm a piano player. I was playing 6 hours a day, and I found that I got my arthritis aggravated, so I couldn't even tie my shoes. I couldn't play the piano when that occurred, and that arthritis was preventing me from doing the thing I love, which is playing the keyboard. And so I came back for follow-up treatments on my wrist, my right wrist, and the next day I started playing the piano, and now I can play the piano for a couple hours. I'm practicing and working on new songs.
Had you seen a doctor for your hand previously?
Yes, I have x-rays before, and I'm going to get x-rays after a year or so and show that doctor how wrong they are.
So what did that doctor tell you?
He wanted to do surgery. He says, well, you can do stems if you want, but you're still going to need surgery.
Oh my God.
And so I know my hand, I feel the healing, amazing experience.
So cool. So what are you doing now? What are you getting treated for?
I'm doing a follow-up for my wrist arthritis. I'm doing a follow-up PRP today, platelet-rich plasma.
Awesome.
It's been 3 weeks since I did my last treatment. It's been 2 months since I did my first treatment on my thumb. After I did that first treatment on my thumb, I started playing 6 hours a day, and then I noticed that my little finger, the right wrist, where the joint of the finger meets the wrist, and my ring finger, where that joint meets the wrist, was getting sore. That whole bone was hurting, and so I was going, wow, I need another treatment. I can't stop playing the piano. As long as I'm breathing, I'm going to be playing the piano.
So cool.
So I went back, and I'm back now. This is my follow-up treatment for my right wrist.
So awesome. Thank you for coming back, Ozzy.